Welcome to today's video is on role of nurses improving quality of care in healthcare settings. So today we'll see what is the role of nurse in the quality and in healthcare. So nurses are the largest group in the healthcare professions. Everyone have seen that nursing department is having the majority and they have the power to treat, to care the patient, because they are there with the patient 24 bar 7. They can prevent the error, they can find the problem, they can implement the quality initiatives. They are eligible, they are efficient to provide the effective healthcare to the patient, to provide safe, patient centered, and timely care to the patient. Nurses play a critical role in the quality improvement. How? Let us see. They are Nurses should deliver the safe and effective care. How? By to follow the protocols, to follow the clinical guidelines, and they have to follow the evidence based practices. How that it will be? So every hospitals, the SOPs are there for the nursing or for the other department also. So nurses should follow the SOP, standard operating procedure, for all the services what they are doing in their work period. So they have to follow the clinical guidelines, standard protocols, evidence based practices for the infection prevention, fall prevention, pressure ulcer preventions, right? So they should monitor the patient closely. They should recognize early signs which is deteriorating the patient, and they should intervene promptly. They should monitor the early warning chart through which they can prevent the patient deterioration, they can prevent the patient goes to the high risk, and they can inform to the doctor too for the patient safety. They can take a prompt decision on the patient condition. They they are important to deliver the safe care through the proper medication administration and infection control practices. Promoting patient safety. How to promote patient safety? To follow the fall prevention checklist, to follow the pressure injury checklist, to follow the medication chart, and to prevent the hospital acquired infection. So fall prevention, how they will prevent? They have to do the fall prevention tool checklist every shift for every vulnerable patient care, or daily ones for the general patient. So as per the fall prevention tool, Morse fall score scale, they should prevent the fall for the patient. They should follow the medication chart, whatever written by the doctors. They should write whatever they have given already to the patient. They should do the signatures properly. They should follow whatever written the order, so they can prevent the medication error. Pressure injury. For the pressure injury, they should follow the pressure ulcer tool, so they can prevent the pressure injury. Every shift they have to check the patient for any pressure injury, and they have to fill the checklist. Hospital acquired infection, SSI, COTI, VAP, and central line. So all associated infection checklists are available in the hospitals. So they have to follow that, they have to feel that, and they can prevent, they can promote patient safety through that. Patient centered care and advocacy. What is patient centered care? Nurses important job is to understand the patient needs, what patient want, and how they can deliver according to the patient's need, and preferring the patient requirement. If patient wants this medicine not to be taken now, or they want taken to be later, they have to respect their decision, and they have to, if that is more important, then they have to counsel the patient, not they have to force the patient or they have to scold the patient. right? So preferring the patient requirement, following the patient rights, and involve the patient in the care decision. Whatever you are doing, inform the patient that you are going to administer this drug this time for this treatment. So patients should know about their treatment, what they are receiving. So patient also will uh, support you in their treatment. Educate the patient and do the clear communication with the patient. Don't tell patient here and there. Do the clear communication so patient can understand and patient will support you in their care. Patient-centered nursing care enhance the patient satisfaction for the better health outcome. If patient is not satisfied, then your health outcome will be zero. So always nursing should be patient-centered care. Participation in the quality improvement activities. All nurses should participate in the QIP projects. It's not the only nursing head or CNO or ANO's job or nurse educator job to do the quality improvement project. They are the leaders, but you people are the major role for the QIP projects. So nurses are major role to do the QIP project because they are spending more time with the patient in their department. They knows what is the error, how to prevent, and they only can implement. So nurses are the major role for the QIP projects. Audits, to support the audit, to do the audits and to correct it. Data collection, all the quality indicators will be collected by the nurses. Incident also to be reported by the nurses because they are available in their job and with the patient every time. Implementation of the preventive action also their job. Collaboration and teamwork. They are equally collaborated with the physicians, pharmacists, housekeeping staff, administrative staff, and they can reduce the error and ensure the continuity of the services. Not only the treatment clinically, they are equally helping the patient for the non-clinical also, like patient uh, in washroom, patient's grabber is not there in the washroom, so nurses are informing to the maintenance staff to install it, or the wash basin pipe is not working, then also it is. But nowadays hospital is having direct contact from the patient to the maintenance staff to reach through the complaints raising system. But still nurses are the important in this because patient know to the nurse only, not to others. So they are doing the teamwork and they are providing the continuity of the services. Nurse play a central role in improving of quality of care in the healthcare settings through clinical practice, safe clinical practice, advocacy, participating in the quality improvement initiative, effective collaboration and teamwork. Strengthening nursing involvement in the quality improvement is the essential for achieving high standard healthcare delivery. Thank you. If you like, please subscribe my channel, comment for any topics, or if you want to give any suggestion, please do comments. Thank you so much.